All right, so welcome everyone. I am Dr. Marcio Galeato from UNICEF, and thanks for coming, and happy to be starting now this webinar with the opening remarks of my dear colleague, Brendan Cahill.
Thank you, Marcio. It is my honor to direct Fordham University's Institute of International Humanitarian Affairs and to welcome you all to this webinar this morning. This discussion, moderated by Marcio Galeato, will focus on the mental health and psychosocial response in Ukraine and brings together three experts, Dr. Jones, Dr. Frankova, and Professor Chaban, to bring their unique insights and experiences to the question of what do children need during this time in Ukraine. The Institute, reporting directly to the provost of Fordham University, acts as a bridge between the humanitarian sector and academia. This is done through training, research, publication, and webinars such as these. Our mental health and complex emergencies program, which is a really wonderful course, is held every autumn, and Dr. Jones and Dr. Gagliato are two of its course directors. We are also developing a program specifically around MHPSS and Ukraine. I want to give a special thanks to Alexandra Jelinek from the Institute and all of the interpreters and technologists who have worked behind the scenes and have made this possible. We look forward to welcoming you back in the future to other webinars, and I look forward to listening more to the experts today. Thank you very much. Marcio, over to you.
Thank you very much, Brendan, and it's a big pleasure, everyone. I want to welcome all the participants. We had a massive number of participants registering for this webinar. We crossed 1,000 registrations all over the world, and this is for us a very important sign in terms of the relevance of this topic, how urgent it is to be discussing what do children need. How we can provide mental health and psychosocial support, a conversation about the provision of mental health and psychosocial support during this very difficult time that we are in. And I want to also extend thanks to Fordham University, to MHPSS.net that has been a partner for this webinar as well. And we from UNICEF, I'm here as a UNICEF expert responding and supporting the emergency to better reach the population affected by the moment. And the context of this webinar is exactly coming in this context. This webinar is not necessarily the opinion of UNICEF, but basically we understand that this topic and this discussion is urgent to happen, and we are happy that we are hosting and facilitating this discussion with three renowned professionals in this field, which I have the pleasure to introduce to you all. We have here the first presentation from Professor Oleg Shaban, who is a psychiatrist and psychotherapist, Doctor of Medical Science, the head of the Medical Psychology, Psychosomatic Medicine, and Psychotherapy Department at the National Medical University in Kiev. And followed by Professor Oleg Shaban, we are going to have the presentation of Dr. Irina Frankova, who is also a clinical psychologist and an assistant professor at this same department at this National Medical University in Kiev, Ukraine. And we have here also the presence of my dear colleague, Dr. Lynne Jones, who is a child and adolescent psychiatrist. She's a writer, has a very extensive field experience in the humanitarian field. Is actually a person that I myself have learned a lot over the years with her own experience. So thank you very much. I hope this will be a very interesting exchange. And I pass the floor to you, Professor Oleg Shaban. Thank you very much for this opportunity.
Hello dear friends, and thank you. I hope you can see the slides, right? So I would like to say thanks to UNICEF and Marcio. When I hear words that I'm famous, well, I think no, there's still way to go. I have this idea that if the cats are petted, then they grow bigger. So this petting is good. But now let's talk about the issues. The topic essentially is evident. Children and war in modern Ukraine, vulnerable and early to become adult. Or we'll talk about the problems of children without childhood. I'm a professional, but I'm also a father and a grandfather, and I haven't seen the issues of this scale yet. I didn't have this direct experience. So unfortunately, I am only getting this experience in the course of my work. So uh, mental disorders in children, which I see in my work, uh, they have the following specifics. I am now in Kiev, and recently the air raid alert has been cancelled. I just came back up from the bomb shelter, and I'm here with you. But if the siren goes on again, then I'm sorry, I will have to go back to the shelter. But I hope it won't happen. So, what's the specifics in mental disorders in children? The anxiety disorders have increased. The OCR, panic disorder, social phobia, um, night fears, and behavioral disorders are more frequent. We also see regressive behavior in more in both adults and children. And I wasn't expecting that, for example, adults will have hysteroid disorders, but children have it even more. Enuresis, the fear of darkness, sucking the finger, or rocking of the body. The teenagers, they have more aggression, or they are silent sometimes, and self-harm also is prevalent, and very often they are in the gadgets. They just want to switch off the world, and I think after this war is over, we'll have another issue. We'll have a new wave of gadget-depending teenagers. Also, we have a problem of the break in continuous education. It's become a problem because, first of all, we had one huge problem of COVID-19 with online education, isolation, interruptions of education. And now it's even worse because now there is this unexpected problem that the teachers also are massively on the move. They are now all over Europe, in Britain, in Argentina. So there's mass migration, and there is a huge problem of continuing the education. The families are incomplete, and also lack of comprehensiveness in the education. When the father, due to some circumstances, the father might be enlisted or elsewhere, volunteering somewhere, well, the families are more under the influence of the emotions in maternal behavior with anxiety. The children do not plan their life or plan it poorly. Everything now is aimed at survival. And this is one thing. And this, I think, is bad because without the plans, you don't have enough motivation. So children's stress, and disorders are mostly tied to the sounds of the war. You see, that is why I have put some pictures which I took from the internet. And well, this is only a small part of what children are now drawing. They draw only one thing: war, explosions, the schools being destroyed. For example, down there on the picture, it says, "I believe in God," and they just pray whoever they can. These pictures are, well, are mostly gloomy. So uh, only through art therapy there might be some optimistic and bright images. Next thing, psychotic disorders have not changed much, but um there is a problem with the interruptions of the medication, if we talk about schizophrenia or other diseases. So what are the issues of work with children when we want to protect their mental health? And here we have a paradox. I want to draw your attention. This is our bitter, or maybe not bitter, but our experience. The mass demand for basic needs of children often is substituted by uber effort to provide psychological assistance built on very good and sincere altruistic motivation, but with low professionalism and lack of knowledge of the neuropsychology of children. The psychologists do not consider that the initial stress response as the psychobiological defense of the body. And the famous phrase, the normal response of normal people in an unnormal situation, automatically in this volunteer psychologist's mind becomes the unnormal situation of unnormal people in the unnormal situation. They don't have these regressive shuttle forms of psychological protection of children when the satisfaction of the basic needs lead to adaptation. The wish to provide very fast aid creates the problem of forming the roadmap of psychological support or sometimes psychotherapeutical supports. And now we can see acute stress disorders. We see the acute nature, but the bigger mass of PTSD will start in a month or two, and now we can only see the small part of PTSD. Next problem is the wish to provide this fast aid and uh, the barrier to medicinal support. The fathers and mothers, they do not have time to get into the details of these issues. And very, very often they just say, just give me a prescription. I want a pill for my child to sleep well or not to scream and so on. And some anxiolytics are prescribed. So there's no understanding of safe medicine or safe psychotherapy or safe psychiatry. Another problem is that our friends, the colleagues who are now volunteering to help, and it's good that they help, but we cannot properly follow up this support. There's no supervision. We cannot make sure whether these specialists resolve their own psychological problems. Now there's this massive pressure of the mass media with these grotesque images, and it's traumatizing even for healthy adults, not just for fathers and mothers, but even for psychologists. Today, I read an article um, uh, on children being raped, and it's very difficult to come unaffected after you read these articles. So the psychologists would automatically have the protective function switched on as mothers and fathers. And instead of the professional psychotherapy, we will see the figure of the mother consoling. So this supervision is, well, it's non-existent now. There's zero supervision now. And I would like to leave more space for the discussion or responding to the questions. So I will be over with this brief introduction, and thank you so much for this. I wish you very warm thoughts. Take care of yourself and your children. Thank you.
Thank you very much, Dr. Oleg Shaban. I appreciate your inputs in your presentation, and exactly to save time so we can come back to debate, because this is also part of the aim and the scope of this presentation here. A discussion between us. I want to pass it over to you, Dr. Irina Frankova. Thanking you again, once again, for your availability and support on the organization of this webinar. You're muted.
Thank you, Marcio, and thanks to all the organizers for inviting me. Indeed, it's an honor for us to speak today with such a big audience. And I want to continue the topic raised by Oleg Chaban and talk about the difference between the first psychological aid and psychotherapy, and to expand the idea what should be done and what should not be done. So, war directly affects the mental health of children. Unfortunately, also has some indirect impact through the family, through the functions of the family, through the style of parenting. Also, it affects through the experience of being forced to flee, to be displaced. This is the new experience for children. Sometimes it's the experience of poverty, the experience of dependence from aid. There are more conflicts and cruelty in the family due to lack of resources for the adaptation. Also, not seeing the loved ones, loss of social connections, and lack of certainty regarding the future. So when I look at this scheme, I remember my own experience when I was 4 years old. My father was in the military, and unfortunately, on duty, he was seriously injured. And for about a year, he had to stay in hospitals for rehabilitation. So those images from my childhood are now very bright in my mind when I am thinking of what the children are feeling due to this war in my country. On the other hand, I probably would not have selected the profession of the psychologist if I didn't have this experience in my past. And I'm very happy that today I can talk to you from my experience and from the experience of our colleagues who work in international missions to provide psychosocial support to people who were forced to flee, who encounter this traumatic experience. And they tell that there is a series of issues in this acute period. The volunteers, the social supporters, the psychologists who provide aid, very often they presume that most of the people they encounter are already traumatized and they need therapy. That's why they focus rather on traumatic events rather than just adaptation to the current situation. They spend resource on the detection of symptoms. They use these terms, symptoms, syndromes, disease, and they provide rather trauma-oriented counseling than what we call first psychological aid, which is based on the phenomenon of resilience. The researchers have this agreement that depending on the timeline after the traumatic event, well, the type of care should be defined. When we talk about the situation of danger, of direct threat to one's life, we have to focus on the optimization of survival. And we thank Professor Arik Shalev, who in the very first days of the war uh, has given this expert assessment. He worded it very well, that this optimization of survival for those who are in danger should be based on the calibration of expectations, like what effectively I can achieve in this situation and what is unrealistic. Also, in help establishing some connections with family, with the community, establishing routines, having some hopes, and the screening of changes of mental health. Next, in the next days, it's about first psychologic aid, stress management, and only after the professionals and specialists can diagnose something, then we can talk about the trauma-oriented therapy. So let me remind you that the goal of the first psychological aid is to reduce distress, to help with the adaptation uh, where the person is, and not to learn about the details of the traumatic experience. This system has been created not only for the grown-ups, but also for children and teenagers. So these concepts can also be applicable for the youngest people. There are these 5 empirically confirmed early intervention principles by Professor Hubble, a US researcher. And whatever we do, be it group work or individual work, or working with parents of the children in the situation of emergencies, in the first response, they have to be aimed at ensuring safety. They should correspond to the urgent needs, basic needs of food, water, medicines, healthcare. Secondly, all the interventions which help the child to be calm, which help establish connections with the family or with other children that help children establish control over the situation, all will be useful. I would like to remind you that from the first days of the war in Ukraine in different communities, we um, have been forwarding the WHO guidances in Ukrainian, and they are available for free at the link. And they provide very effective methodology to reduce stress, to have relaxation, breathing techniques, and so on. So, the difference between first psychological aid and therapy are the following. The psychological first aid is the method to stabilize in critical circumstances, and it's provided to the survivors, so a very wide circle of people in the community. And very often it is provided in shelters, in hospitals, in community centers, in schools, so anywhere. It doesn't require the provider to be a licensed specialist on mental health. Most often, it is just a one-time interaction with the person, and the main objective is to identify urgent needs and to make sure that the person is referred if necessary. When we talk about therapy, very often it's not just a one-time meeting, but it's several sessions or throughout some time. There are interventions to modify the emotional uh, state or the cognitive conditions, so to change the way the person sees or thinks about the situation. And the clients receive help from those who are licensed to provide this type of care. I can give an example. There's a situation when a child has recently been forced to flee. So the child is in a playroom or next to other children and is playing with toys or drawing. So the therapeutical response would be to interpret this drawing and to use this interpretation to resolve some emotional or behavioral problems. But the psychological first aid response is using this play to help the child restore the normal state, the feeling of safety and comfort, and to establish connections with other children. Another example on parents. When the father, feeling guilt in what has happened and probably blaming himself, like in this example, that he's blaming for leaving the family and enlisting to the front. When the father is talking to the specialist, we see that he's anxious, he has thoughts, and they are evident for us that the The father is alarmed because of the security of the family and looking forward to the messages from his wife. So the therapeutical response would be finding the way to rescript these thoughts, restructurize them, make these thoughts in a constructive direction. But the psychological first aid response would be to inform the person about the situation from verified sources, provide the phone if necessary, so that the person would call the wife and the children and talk to them. So it is clear that interventions are aimed not only at children, but also at the parents. And what helps in this situation is when we are teaching parents to deal with stress. We teach them what is a normal response in the situation of acute stress. We tell them we teach them how to recognize stress in children and which coping skills are there in children or in their family, and remind them how to use it. Also, we are it's about providing safe spaces for children and babies when they need our help, and supporting social workers and the volunteers which provide some care at the community level.
Ми розробили таку інтервенцію у вигляді комунікації з
So we designed this intervention as a communication. It is low intensity intervention. You can use your mobile phone to communicate with an imaginary counselor, say. It is based on 5 key pillars. And what's important, these guidelines from an imaginary psychologist or a friend are adjusted to the war reality. So ultimately, the child communicates with different adults, the healthcare workers, the parents, the volunteers, the community, and we should keep in mind
społeczności z rodzicami і з психологами. Trzeba
коротким резюме, чого не слід робити, чого слід уникати при наданні психосоціальної або першої
as in
психологічної.
what you do not do when you provide first aid, psychological first aid to the child. First of all, do not assume what the child is going through and what they have gone through. We should rather be listeners. Instead, refrain from thinking that everyone who's been through the war is traumatized. Do not pathologize, do not mark the reactions as symptoms, and refrain from using the terms as diagnosis or conditions, pathology, or disorder. Do not belittle the survivors and do not patronize them. Instead, focus on their strengths. Not all those who have been traumatized want to talk about it, and it's not necessarily bad. Sometimes you just need to be there for them. Refrain from asking about the details of what's happened to them, especially in those first few days. Refrain from giving them the information that you haven't verified. And if you reference something, make sure it's a solid fact. And also refrain from some kind of innovations or innovative interventions, or from presenting your own thoughts as facts. So how do we sum it up all together? Do not pathologize normal reactions to an abnormal situation. Do not go too much into psychology. And as someone can just rebound using their own strengths, do not try to exacerbate the emotional reaction. Refrain from exacerbating the emotional reaction through group therapy or debriefing. And of course, wherever possible, we should refrain from prescribing medications to children. because I'm afraid we have been getting those requests to use benzodiazepines to treat children. So thank you so much for your attention. I'm ready for your questions when they come. Thank you.
Thank you, Irina, for this comprehensive presentation. And I want to go straight to Dr. Lynne Jones and pass to you, Lynne, thanking you as well very much for your availability and readiness to bring all your experience to this presentation.
Thank you. I just want to check that you can see the full slide, not my notes.
Yes, exactly.
Great.
Yeah.
Wonderful. Okay, it's such an honor to be here with these really esteemed colleagues, and thank you for inviting me to be part of this. What I want to do is share some of the lessons I've learned from working in different conflict zones around the world. Particularly, I want to challenge some of the myths and stereotypes about the impact of conflict. Irina's already done a good job, but I think my talk complements hers. I want to focus on the Balkans because that's where I began my humanitarian career. I was there for 11 years during all the wars. And there are many parallels that I see between those conflicts and this current one, not least living under intense bombardment, siege, the committing of war crimes. I was there both as a clinician during and after the war, and then a researcher. I began my research in 1998, and I've continued it up to the present day, actually, because I've been lucky enough to be in long-term contact with some of the children, they're not children anymore, who I worked with. So I'm going to share my findings from that and feed in some of my experience in other conflicts in other areas. I'll start here in Sarajevo because that was where I began under a siege in '94. And I've deliberately put up this picture, which is of the London Blitz, because the children don't look very unhappy in that picture. And like my own mother, some of them were having a really good time, sleeping in air raid shelters, watching bombs fall at night, but actually seeing it as one big playground. I've written everything that I have to say, by the way, is in this book, which is available here. Then They Started Shooting, which is a summary of all my research work. So Anna Freud was working in London during the Blitz, and anybody who has the time, I recommend Wartime Nurses. It's absolutely brilliant if you want to understand children in wartime. She ran nurseries in North London, in Hampstead, for the whole of the war. And what she saw was that those who were evacuated away were much more unhappy than those who stayed with their parents. Obviously, there were physical risks, but mentally, you were better off staying with your parents. I'm going to read this so that the translators can translate. Our own feeling revolts against the idea of infants living under the condition of air raid danger and underground sleeping. For the children themselves, during the days and weeks of homesickness, this is a state of bliss to which they all desire to return. My lesson number 1, children are better off with those they love. And I found this again and again. I went back to southern Bosnia. I worked and lived in
лучше справляются как
I w innych miejscach, które były bombardowane przez
ones who live with their families.
Тому в країнах
Away from their families, living with grandparents, living with strangers, having 4 years of anxiety and worry. Indeed, one of those children who I followed up 20 years later told me that she'd given up her university degree in Belgrade, come home to live with her family, because the 4 years that she'd spent away from her family in safety with her grandparents during the war still were upsetting her. To quote, "I'm filling in holes. I'm trying to make up what I missed." Now, I've seen her again recently and she's doing well and she's living in France, but it's very interesting that those are enduring effects. If loss and separation are enduring, it follows that actually, and this does not get enough attention, losing a parent or close friend through death is, I believe, the worst thing that can happen. This has been my experience in every conflict that you work in. Please pay attention to grief, not because it's an illness, not because it's pathological, but it seriously affects children. And if children are supported well through grief, they can do well in the long run, which is why I show this picture of these 4 young Kosovars whose parents and grandparents and extended families were shot to death around them in a massacre, and who still continue to love and pay attention to those relatives, but are all doing well in their lives now. Pay attention to grief. Understanding and supporting children through grief and loss is as important as understanding trauma. And I've provided reading materials in Ukrainian, Polish, and English, and also a chapter in English on this topic. If any of you want it, it can be sent out after the talk. I'll talk quickly about one example. This young man that I interviewed was a boy of 14 or 15. Now, when we tried to see how he was on a symptom checklist, he appeared fine. When I interviewed him, I discovered that he was still deeply engrossed in his elder brother's death. He thought about him all the time, dressed in his clothes, tried to act like his brother, went to the grave every week, really wanted to be his brother, and told me, sometimes I'm not able to learn. I'm not interested in anything. I don't want to play, nothing. He was grieving, and this did not show.
Играть, учиться, он постоянно.
Widać na checkliście symptomów.
I don't know what's happening in Ukraine, is that the psychologists and psychiatrists of the world, mostly from abroad, were absolutely rushing about the place with checklists and saying, oh, these people have got PTSD, these people haven't, because the Harvard Trauma Questionnaire was showing that they were fine. This is not good enough. Symptom checklists pick up transient emotional states, exclude those who can't express their distress in other ways, may not be culturally appropriate, can label sick children as well, but more importantly, can label, well, both ways aren't important. You miss a child who's sick and you label children who are well in the wrong way. So you need to supplement it. If you're doing an assessment, you can't just do it through symptom checklists. One of the tools I use in discussion with children is a lifeline. I don't have time to explain it here, but basically for a week or a year or 2 years of your life, you put dots on a line without having to talk about what happened to show how happy you're feeling. The typical line that children gave me for the Balkan Wars, surprise, surprise, was a brown line like this one, which was pretty good before the war, went down for 4 years and went up again when the war was over. I was looking at a 6-year period, but not all did. Some very bizarre things showed up when you tool like this. Like for one girl, and there were others like her, the best year of her life was the worst year of the war in Gojda, when they were being bombed, when you could only get food through airdrops. But guess what? Something was different at home. Her father wasn't there, and the family violence that had bugged her for years stopped. But when he came home again after the war, it started again. And this is another very important lesson, not just from me, but from other researchers around the world. Wonderful research by Catherine Tantabrik in Afghanistan. Family violence can be worse than the violence of war, and was a key, in her study, was a key predictor of child mental health. Now, here's the tragedy, of course, is that family violence can increase during war. And one of the things that UNICEF annual review recently showed is that actually harsh parenting and family violence goes up during wartime. So you have a compounding effect. But really be aware of this. And I came home to work in Britain, and I've seen more cases of PTSD from family violence. So do be aware of this problem. And there's another stereotype, which is the more violence you're exposed to, the worse you're going to be. And so if you have lots of bombing, then you'll be worse off than somebody who isn't bombed or has only 1 day of bombing. Again, bizarrely, I found quite the reverse. The city that had only been bombed by NATO airstrikes for 2 days and no one had been killed had more children who were frightened and remembered bombing than the city that had been bombed for 4 years. Now, how do you make sense of that? Again, that's a whole lecture in itself. But what I want to say, the short answer is meaning matters. It's not the direct experience of the violence, provided it's not intrafamily violence. It's how you make sense of it and what it means to you. And I found that violence were actually more empathetic, more able to cope than those who'd only had a short, frightening experience, but were living in a city where they were highly stigmatized. The meaning of the experience matters as much as the dose effect. That's lesson number 5. Now, this is another very important lesson for me as a child psychiatrist, and it's applied in every conflict in which I've worked. Please seek out those children who are more vulnerable, those with learning disability, those with severe mental and neurological disorders, particularly institutionalized and abandoned children. They are in every country in the world. They may be shut away in horrible institutions. And in this one that I show you a photograph from Kosovo, all the staff had left. 5 people were taking care of 35 children and 100 adults. They had no food. They had no clean water. They were lying in dirty clothes. Look for these children. They need our care, and they are among the most vulnerable. Please don't forget them. So I'm going to come to the end of the lecture. I'm not finished, but I want to explain a more complex story, because this family, absolutely wonderful family with whom I'm still in touch, taught me so much. Arlinda, it's a family tree you'll be used to. Arlinda, who's the key figure here, she was 14 years old. She was living with her 2 extended families, very common in Kosovo. The fathers had moved to the hills because they thought it would be safer for the elderly relatives and the women and children if the adult men were not in the house. It wasn't. The paramilitaries arrived, entered the compound, rounded them up, played games with them, shot over their heads, made them lie down on the ground, made them get up, pushed them all into the corner of the garden, raped the mother of Arlinda, and then shot them all dead. Arlinda was shot herself. Her brother's head exploded in her hands, if you can imagine that. But 5 children survived this terrible massacre. And I came back into Kosovo a few weeks after and was asked to see them. And I have remained in contact with the family ever since. What was so interesting and what they taught me was that this was a horrifying event that 5 children of the same family handled in totally different ways. So Arlinda had classic PTSD. What a surprise. She wanted to talk about what had happened. She wanted to replay it. I know what happened because she took me around the garden replaying the whole event. That was her choice. I didn't ask her to do that. One of the boys had talked to journalists at length. He said, "That's enough, Lynne, I don't need to talk about it again." One of the girls was very sad and did not want to talk at all. One of the children was in hospital, and my job there was to get a connection through the ICRC so she could actually connect with her family. And what we did was we had to communicate that the rest of the family are dead, because one of the children, or 2 of the children in fact, said, "We don't believe that our mothers are dead." So one of my big jobs, and this is what I've written books and leaflets about, is how do you communicate death to a family? And then what do? Do you force children to go to funerals? No, you don't. If they want to go, they go. If they don't want to go. And then we talked a lot about happy times. And all the children, I'm glad to say, they were evacuated briefly, for a few years to England. But Arlinda is now a leading politician in her own country. She's an artist. She's doing extraordinarily well. Every child, this is number 7, is unique and different and has different needs. We need to respect that. And then I'm very glad that we brought up, thank you, Irina, for bringing up the issue of, and Oleg, for bringing up the issue of drawing, because again, I've got another, do we force children to talk and get the experience out, which was a very common approach in psychological debriefing, was all the rage in the 90s. Get everybody who's exposed to trauma to sit down, draw about it, talk about it, and then make them talk about what happens. They will process their emotions, they'll feel much better. We know now that that is not true. It might be good for some, but many people don't like it and feel worse after, and some are even made worse by it. So no.
Этого не любят и чувствуют себя хуже.
Жодної універсальної відповіді.
Тут немає якоїсь універсальної формули. Ми не
want to draw about what's happened. As Anna Freud said, they will draw what they see around them. And they may draw tanks and guns the weeks that there are tanks and guns, but then if you put them in a garden with flowers, they'll draw flowers. But what you need to understand, and I'm going to read here, is in all these instances, speech is not the outlet for emotion. It is rather the other way around. The child begins to talk about the incident when the feelings that were aroused have been dealt with in some other manner. So actually the child needs to process their feelings before you force them to talk. And that's from Anna Freud, who really does know something about psychotherapy. So please, lesson number 8, do not force talking. Children do know how and when they want to tell their stories. And that might not be the most convenient moment for you, but if they actually going to the railway station or sitting in the bus shelter or late in the middle of the night want to talk to you, make sure you can listen. They choose the time and place. And this is the final lesson that this family and many others have taught me, that justice matters. So those children who didn't want to talk, Well, the War Crimes Tribunal came to me in 2001 or 2, I can't remember, and said, we've got Milosevic on trial. These children are witnesses to a gross war crime. Do you think they'll talk to us? I said, well, I have no idea. Let's ask them. So they all sat down in a room with me, and I said, this is the situation, and you do not have to talk. If you do, it'll be in a protected video space that the British police had in those days. Every child wanted to give their testimony, and I sat through a day of hearing the same events for the first time from every child, all 5 children, telling me what had happened because it was going to mean justice. And then he died, no war crimes trial, but then one of the soldiers who'd shot them was on trial in Belgrade, and they rang me up, I was in Iraq at the time, and said, please come with us, we're going to Belgrade and we're going to be witnesses. And once again, I saw every child with enormous courage, first of all, identify the perpetrator. I get tearful when I think about it, and then stand in the witness stand and give their testimony again, because it meant justice. It also meant reconciliation. They made friends with the Serbian people who were taking care of them. They told me they recognized there was a need for forgiveness and reconciliation. Justice, lesson number 9, can be therapeutic. Finally, just to summarize my findings, which basically confirm much of what Irina said, from 20 years of following up, I think these lessons are relevant to Ukraine. Please keep children, if you can, embedded in communities and families, whether evacuated or in the place they're staying. Separation is bad for the child. If they have to be separated, get them back to their families and those they love as quickly as possible, because that is the route to recovery. The loss and death of a parent is more important and more enduring than exposure to bombing and shooting. Also, something else I learned, which may come up after this war is over, and I hope it will be, remember that impoverished, isolated, neglected, post-conflict communities can be as damaging as exposure to bombing. That's a whole other topic, but I just want to flag it. What I found, I went back to all these children in 2012, I did a formal return, and what they tell me is, wars actually made us stronger. It's increased our resilience to negative-like events. One girl said, Lynne, it's like a vaccination. I'm much better able to cope, and she had to cope with her father dying of cancer. I'm much better able to cope when things go wrong now because of that experience. I'm not wishing this experience on everyone, but it is not the end of the world. So my final lesson, not all children are traumatized. Research shows that if protective factors are in place, such as healthy family connections and a caring, supportive community, the majority are resilient. Thank you so much for inviting me to speak here. I'm happy to answer any questions, and as I said, there's materials to share if you would like to see them. Thank you.
Thank you so much, Lynne, for your thoughtful presentation, which is also, for those that don't know, this is also an article that has been published at the Lancet. So it's worth, I'll be happy to be sharing this
Just to be clear, the Lancet article is very general and draws on many conflicts. What I've presented here is Bosnian stuff. So if people are specifically interested in Bosnia, I have more specific papers on that, and I can send. Thanks.
Thank you, Lynne. Well, I do want to leave the floor ready as well for Professor Oleg Shaban, Dr. Irina Frankova, and Lynne to also have a conversation. If you have, feel free to jump in and picking up from each other's presentation. I think we had different levels of presentation here in terms of very clinical approach, very clinical understanding, readings, speaking to that level, and also coming to the importance of looking of what has been one of the very important considerations we bring as a lesson in terms of mental health and psychosocial support in contexts of large humanitarian crisis, where suffering and violence is so much widespread, which is the perspective of what the field has been in the past, very focused on the vulnerability perspective when doing interventions, to a more resilience perspective. I do see that often in every emergency, and here hasn't been different. I do see a strong tension when it comes to mental health response, psychological response, mental health and psychosocial responses. The tension of the concentration, the dominant narrative that we need to respond to the massive suffering that the population is going through, right? And one of the key lessons that we bring, we try to bridge in an exchange format, that few things that we kind of have been carrying from different contexts, and that we would like to share as lessons for every occasion. And we do see that this is also a very critical point to be highlighting. That again, it's exactly the whole of the community in the well-being process, exactly to avoid that people they come or they develop conditions. Is exactly urgent to be focused on the whole of the community in how they can and they must be supporting each other and be empowered to support each other in a way that a classic definition, which is I think one of the ways of carrying a definition of mental health and psychosocial support. And I conclude here, and I leave the floor for the presenters. Is mental health and psychosocial support is about providing a humanizing response to a very dehumanizing experience. So I open the floor to, I don't know, we have received a number of questions from the audience before this event. I have selected a few here to pass through the panelists, but I just before that I want to ask if any panelists would like to make any mutual question or consideration based on each other's presentation, or we go to the questions. Lynne, you are muted.
I'd like to go straight to the questions if people have them, all the questions on the list. Yeah.
Sounds good, Lynne. So I will start then perhaps with you, Professor Oleg Shaban. One of the questions that presenters, the participants they have made before this event is how can we protect the mental health, the well-being of workers, frontline workers at this moment? What has been the considerations that we need to take in place of these hundreds and thousands of frontline workers at the moment?
Дякую, гарне питання.
Thank you. That's a good question. Three things: screening, supervision, and balance. I saw that this is the fastest tool. Then we will have self-education and work with other psychologists. Well, that is rather about supervision, but giving some fast tools, for example, to diagnose the burnout syndromes, well, they are needed. The psychologists know how to provide care, but very often they forget that the volunteers burn out the first. So people who work with emotional problems, they burn out the first. So everybody knows the term, the burnout syndrome, but nobody diagnoses it. So first, to give the tool. Secondly, giving knowledge. And number three is working with other specialists.
Thank you very much, Professor Oleg Shaban. I can see here Irina and Lina raise their hands as well. Lina, you want to start and then we go to Irina?
Yes, I completely agree with the professor, of course, but I want to add two lessons. And if any of you are either organizers of other volunteers or helping yourself, or a manager, even more important, this is mandatory. It's called rest and recreation, and it is not voluntary. You are not indispensable. And if you don't take yourself out of the situation for regular breaks. UNHCR in an emergency, for example, used to, I haven't worked for them recently, used to say 1 day in 7, 24 hours off. We don't care if you want to stay off. And 1 week in 8, completely out of the situation. Otherwise, you will be in the situation I was in Haiti, where I had surgeons begging me to send a nurse back to the US because she was refusing to take time off and was making their lives hell. No one is indispensable. So please organize in your structures time off regularly. Go and look at a tree, paint a picture, do whatever you like, listen to your favorite, but out of the work situation. That's my key lesson.
Irina?
Обов'язкові ротації.
And yeah, ensure rotation, and in COVID essentially helped us. We have been working to develop these digital tools so that the physicians would understand whether they are still resilient or they are vulnerable to the stress they experience, because the therapists very often they disregard their own mental health.
Thank you very much. And then another question that I would like to pass to the panelists, perhaps to you, Irina, in terms of, and others can also feel free to respond to this question, but crises are sometimes, we have learned in the humanitarian context that crises sometimes can also be opportunities on what we call building back better. In terms of rebuilding so what could be at the moment things that we need to be looking at? There are so many considerations here, but what are the few considerations you think we should highlight when it comes to this process of building back better? And
Сподіваюся, я вірно зрозуміла ваше питання.
I hope I understood the question properly, Marcio. You are probably talking about this so-called psychotraumatic growth, when we can use the opportunity of the situation for the personal growth of the individual to overcome the situation. Professor Shalev, whom I already mentioned, he focused on the following thought. Every individual should try to take the most from the situation where they are and use it to its benefit.
thank you, Irina. Lynne? You're muted.
I think you should take the professor first because he's in Ukraine.
Yeah, sorry, Professor Oleg Shaban.
Дякую, Лін, але я підняв другий.
Thank you, Lynn. Well, I wasn't the first to raise the hand, so you were first.
Okay, well, I'm going to talk about other conflicts, what we mean by building. I completely agree with what Irina says, that it is, of course, an opportunity for growth, as every experience is. I've broken my ankle, and I can assure you I'm going through a big opportunity for growth at the moment. The pain's incredible, and I'm learning to live with it. It's very good. Learning what it's like not to be able to walk is very good for me. But there's another opportunity which is presented in every emergency I've worked, including, the first thing that happened when I walked into the Sarajevo mental hospital, wonderful Professor Seric, now sadly dead, he said, Lynn, all my life I've wanted to close this asylum and build up primary healthcare facilities and mental health provided in the community. And what I see is this war may give us a chance. That was the first time I heard that idea. And then over time, in every emergency I've worked, I've often worked in countries where institutionalization, and this is, I don't know Ukraine, is still seen as a solution to serious mental illness. And we know now, and WHO, that it isn't. And sometimes when a situation is being destroyed, you have a chance to rebuild in a different way. And I don't know what Ukraine wants in terms of mental health services or what it had before. But again, we built a community child psychiatry service in Kosovo, which there was no child psychiatry before 1999. Now there are amazing Kosovar child psychiatrists who were trained by me during the war, and they're brilliant. And Aceh, we put mental health nurses in every clinic, something that didn't exist pre-tsunami. So there are these opportunities, actually after the tsunami, I should say. So yeah, there are these opportunities to restructure services in a better, more productive way. And that what you want in Ukraine, of course, is up to you.
Thanks, Lynn. Professor Lekshaban.
Дякую, я повністю
Thank you.
погоджуюсь.
I fully agree with Lynn and Irina. In 2003, there was Bosnia, as Lynn said. In 2004, I was providing care to children after the terrorist attack in Beslan in Russia, if you remember that, when the school was overtaken. It was the 1st of September 2004. And for quite a long time, we've been working with these children. And in the context of Marcio's question, I want to give a very specific advice how we can work with children based on the idea of this post-traumatic growth. The term was from about the same age, 2004. I was working with a girl, Alina. She created a problem for me personally, because when the therapy was over, she got this attachment to the therapist. She said, I want to be your daughter. So it was a problem for me. I had to go back to Kiev and she was staying there. And her family died, but her brother was there. Another brother died, but one brother survived. And it was a problem how to let her know that the other brother died. So this post-traumatic growth, we built it by drawing the fairy tale with the changed storyline. So it became about the responsibility. And I had this idea of how we can develop post-traumatic growth by putting responsibility, which is within the children's possibility. So to empower them. They anyway take responsibility because they grow up fast. But when you show this person that she is effective and very good in their family, we saw she felt really protected from trauma by having responsibility, but it's not imposed, and it never should be an imposed responsibility. Thank you.
Thank you, Dr. Professor Lekshaban. One question that then I would turn to you, Lynn. I think this question was exactly made for you. Takeaway tips for parenting during the war. What are your lessons and that you could share with us?
I can't do that in 2 minutes because that's what I really focus on. One is, especially with the younger children, you know, they will reflect your parenting. So, you know, classically, and again, this is beautifully described in some of the wartime, the Second World War psychiatry, which I document in that Bosnian book, where, you know, one psychiatrist describes how a child with a very anxious and disturbed mother completely reflected her mother's symptoms, but children with mothers who are showing resilience and coping well in the same, you know, bombing and shooting situation are doing well. Children will pick up. And again, in Bosnia, the children who were worried and anxious were the ones who had worried and anxious mothers, worried and fearful mothers. And the children who were okay were the children whose parents were coping well. Now, that's tough on the parents, but they will pick up on your anxieties. So if you can make them feel safe, and one girl, and I see her now, I saw her last year, you know, she remembers her parents creating this lovely, safe playroom in the shelter. And she had dolls. Her brother had a train set. Her father had actually created a dynamo on the river. So he was a bit of a hero in the town because he was producing electricity. They called him Tesla, producing electricity with the town. So she felt she had a strong, wonderful father, and they were making her safe and protecting the community. And that she never had any mental health problems in the war. So one is look after yourself, keep yourself well. The second is give them love and attention. I mean, there's a lovely sheet in Ukrainian that I've sent to Marcio. I hope will be available. But lots of hugs, lots of love, lots of play, structure and routine, all the things we want for a normal, happy life. If you're a parent of children under 3, don't, interact with them. All the things that don't get too busy and too tired to do the normal, stimulative, loving, interactive play that will help them develop well. And Oleg, Professor, you put your finger on it. I am so worried about the digital nursemaid, both for the parent and for the child. Of course, it's a distraction. Of course, it helps children keep their mind off the shelling or whatever. Limit the amount of time and the sites for all children, no matter how old they are, because that is not the route to go. So, of course, you can't say none. Children want to know what's going on and connect to their friends. But, I would say 2 hours a day, or just have a very severe limit on it. That's really important. I haven't got on to how you talk about death because that's a whole topic in itself. But if you want me to talk about that, I can.
Thank you, Lynn. I don't know if Arena, Professor Oleg, want to say something about this question in particular? All right. Yeah, Professor Oleg.
Хотів би доповнити.
I would like to add, I fully concur with Lynn. The smaller the child is, the more it mirrors the most important figure. The child just copies whatever they see. The elder the child is, when it's a teenager, we can address the prefrontal cortex. We can talk and explain. So, as I said, we have great psychologists, but without the understanding of neuropsychology, they don't have an understanding who they talk to. If it's somebody to whom you just show and they mirror, or somebody to whom you talk to. So we need to empower mothers with the tools such as breathing techniques. If mothers know how to overcome an anxiety attack by breathing, well, she will understand how to then use this in their plays with the children. So, for example, in the shelter, they can play with a child. Okay, let's imitate how the dog is breathing. Try imagining how the elephant is breathing. So the breathing then is longer and more structured. So these physiological games are very effective. Of course, with elder children, some other tool is needed. But I see, for example, a big problem working with teenagers who just want distance from their parents. And, well, we actually can reach them through their gadgets or some shared interests. Even if the parents hate the music of the teenagers, well, still, at least we can talk about music and listen to something they like and you like. So when we talk about this de-gadgetization, there's also a question: what do we put in place of these gadgets? Very often the parents don't know how to replace the gadget. They can't compete with the digital society because digital world is way more interesting, bright, and so on. So the parents should be taught step by step what they can do with their children. Thank you.
Thank you, Professor Oleg. Thank you. Well, I must start doing that very tough role, which is concluding our presentation, our webinar, our panel. I'm sure we could easily spend here at least 1 more hour, and especially with the number of questions that we have. Before we do the final remarks, I want to pass to each of you, Lynn, Oleg, and Irina, for final remarks from you from this presentation today. Starting perhaps from you, Professor Oleg.
Можливо, я почну. Я хотів би ще раз подякувати
Well, then I should probably go ahead. Thank you so much once again. Thank you, Marcio, and I would also like to thank the UNICEF and my colleagues. And what's happening is absurd. It just doesn't make sense. Killing another human being, the war, but knowledge is what can protect us. And then you can share that knowledge, your expertise with others. So I would always support any webinar, a congress, a workshop where we can learn something and then pass on this knowledge to others. This is what I teach my students. This is what I teach my doctors. Because protecting yourself might be a selfish thing to do, but this is what you have to do. Like on that plane, you put a mask on yourself and then you put it on the child. And so if we teach each other, if we learn from each other and grow as professionals and learn more about the war in the context of neuroscience, it can protect us and it can help us protect others by passing this knowledge to them. So please, let's continue with these webinars and conferences. Let's keep passing on our knowledge. Thank you.
Irina?
Yeah, I want to thank you as well, dear colleagues and organizers. I feel connectedness with experts all over the world, thanks to those webinars, and definitely from my personal point of view, I would support another webinar, Lynne, with you on so many questions were asked. I'm impressed, and you have this precious experience. Hope we will learn how to help psychologists and other people addressing needs of children that suffer.
Well, thank you. I mean, to all Ukrainians who are listening and to my colleagues who are speaking, thank you for your resilience and your courage and the inspiration you're giving to the whole world. I'm learning from you. I've learned a lot this afternoon. It's really been amazing to be included in this. I'm glad if any of my experiences are relevant. I'm looking forward to the fact that I believe Marcio and Brendan are organizing. I've been a little bit out of things recently, but are organizing some kind of further seminar around child mental health. And, people will be welcome to apply. And that will be more in depth, which is really important because clearly there's a lot to discuss. I think the main message I want to get across is, as Irina said, and as Oleg has shown us, it's not all about making a diagnosis and giving a drug. It's about fostering children's resilience through love and connectivity, recognizing and supporting them in their strength, and of course dealing with the problems as they arise. I love Oleg's example of getting mothers to teach. It's exactly what I did in Kosovo. Got mothers to teach rebreathing to their children so they could relax. And little things like that make all the difference. Support the parents, you support the child. Try and keep the child with a parent-like structure, even if they haven't got parents anymore. And you can do a lot for the child. And thank you for including me in this. Thank you.
I am the one thanking each of you here very much for accepting this invitation. It was a process to conceptualize this webinar, so quickly put it together, and have it today happening. My final word is that humanity bounces back when in faces of violence and all this destruction we are witnessing at the moment. I'm so hopeful, and people, they are also. I think it's the power of humanity. That's the way that I prefer, and I witness myself when I speak to people on the ground as well. Knowledge is fundamental in this process as much as care. And I want to thank you, everyone, for participating in this webinar. This is just a start, or I will not even say a start, because these discussions are happening in different levels And that's one more contribution we make to the ongoing conversations that are happening from different organizations and channels as well. And definitely this is going to continue because it's urgent, it's necessary to support people. I hand over now the very final remarks to my dear colleague Brendan Cahill from the Fordham University, thanking everyone for participating here today. Thank you.
Thanks, Marcio. It's my gratitude to all the participants and especially to Marcio, really for moderating here. That was a great masterclass and it shows all of us how interconnected we all are with one another. For those of us who are parents to, as Lynn said, support the parents, support the children. Please watch this space. There will be more that Marcio and I are working on. And again, to thank those who didn't speak today, but were critical in making this happen. So thanks to UNICEF, MHPSS.net, and Alexander and all the people at the Institute. Many thanks. Take good care, everyone. Be safe, be well, and see you soon.